Imagine a day where children are guided and nurtured in a way that honors their unique humanness. A day where, instead of being expected to change in order to fit in, children can be met right where they're at. Welcome to Where They're Planted, a podcast for parents and care providers of unique children. Caring for a child with a developmental, emotional, or behavior challenge, a neurodiverse brain, or difficult early life experiences can be confusing and exhausting. On this podcast, we'll help your child flourish and strengthen their roots by helping you not only understand them, but also gain the skills to help them bloom where they're planted. We'll use brain science, nervous system tools, collaborative strategy sessions, and a deep understanding of the developmental process to create a fertile environment around your child in order to nurture their growth. I am your host, Jen Bluske, an occupational therapist with over 25 years of experience and a parent coach. My most closely held title, however, is that of a single mom of 2 thriving adopted kids, so I have walked this walk. I am truly excited to share, teach, and dive into these important topics on each episode.
Welcome back to Where They're Planted. I am so excited about this episode. We have been talking about autism and exploring autism both through the voices of autistic individuals, autistic parents, and with leading providers in the community in neurodivergent care. This is something that's so near and dear to us at Children's Therapy Network around how do we really support our neurodivergent individuals in a way that meets them right where they are. And so today, we are going to take it back to what occupational therapy treatment can do to support the autistic experience and how we, in our work, conceptualize our work with autism and to create maybe some curiosity around new ways to envision what meaningful experience function is, and maybe guide parents in ways that they can support their child or create meaningful function for their child and in their family. Today, joining me is Emily Laird, one of our occupational therapists and one of the leaders in work around neurodivergent occupational therapy. Emily graduated from the University of Wisconsin-Madison in 2013 with her degree in occupational therapy. She has experience working in an alternative school for individuals with autism and mental health challenges, as well as in a clinical setting. While pursuing her master's, Emily worked closely with families providing in-home therapy and respite to children with autism and special needs. Emily believes that play is an important activity for both kids and adults as it fosters creativity, connection, and confidence, among other valuable qualities. Her goal as an OT is to incorporate a variety of therapeutic approaches into shared play activities to support individuals as they seek to master new skills. Emily enjoys tuning in to the specific needs of each child in order to meet them where they're at and gently guide them in achieving their individual goals. She is grateful to have a job that does not require her to do the exact same thing more than once and allows her to learn new things every day. Welcome, Emily.
Hi there.
Hello. So, I'm really excited to talk to you today because so far in our series, we have talked to 2 autistic individuals, our teenager and our dad, which I think was really insightful. And then we had the opportunity to talk to Sharon, who just does some really powerful work around neurodivergence and what that means. And I wanted to shift the conversation today to what our work here is. We're both occupational therapists by training and parent coaches. You're in process of becoming a parent coach. And so give it a little more specifics today, like what we do and what that means. And so let's start by having a conversation about what do you see as neuroaffirming care?
Sure. So for me, I am wanting to get really curious about each family and child that is coming in and recognize that maybe they have filled out their intake paperwork and maybe I'm like thinking, okay, wearing clothes is hard, or these things maybe could be easier, or, oh, this child is easily overwhelmed, and how do I kind of take what I know about that and put my expectations on hold. My focus when I meet that family and that child is really to learn that child's nervous system, and that is my guide. Like, I can have all these strategies that tend to work for improving tactile processing, and that is not a one size fits all. So I might ask permission, can I try this? And if it is something that does not seem to be a good fit for that child, I am validating that and recognizing that. And we are not going to go that way, even if it's like, this tends to work, or maybe you've heard this should work, and this is not the right fit for you. And I'm watching to kind of tune into that child's nervous system. I am taking, what am I getting from caregivers and families? What information is like, oh, this tends not to go well. And okay, that's information. I'm going to listen to that and like, okay, why not? But I'm not going to be like, well, it's supposed to work, let's do it. Or also if I'm trying something and a child's like leaning in and do it more, or maybe you see their body exhale or relax into it. Okay, maybe that is a good fit. Or I guess sometimes there's kids where it's like, oh no, it was fine, but I don't know if your body like that. And I'm going to point those things out. Like, here's what I'm noticing. I think there's early on this pressure to be like, this is how it's supposed to feel, or this is how you're supposed to be. And I think early on we tend to tune into that, maybe not consciously, but I really want to learn for that child what they're experiencing and interpret that and validate that that is your response. And that is okay, that it might not feel like it's supposed to.
Quote unquote, supposed to feel.
Yeah.
Yeah. I keep hearing you say you notice what their body's doing. Let's talk a little bit more about that, because I don't know, I think that there's such a key there to truly being neuroaffirming. What are you noticing? Why does it matter?
Yeah. So one idea that pops into my head is I had a 9 or 10-year-old girl a while back where wearing clothing was something that made her really irritable. There were some food things that it was like, I can't eat these textures, I don't like these textures. And there's a lot of things where she was pretty tactily overwhelmed and sensitive. And there's one approach that is from the MNRI reflex integration. I often call it putting pretend frosting on kids. And it's kind of just like a pressure down your arms and a pressure down your legs. And for a lot of kids, that feels good. And you can kind of see them relax into that. And I had kind of shown her, here's what I'm going to do on a teddy bear. And she was like, yeah, we can try that. And I did it. And I was kind of up around her collarbones. And she had like this gag reflex and just like this wiggle to her body. And it was like, we're not going to do this. I often tell kids, like, you're the expert on what it's like to be in your body. I can guess, but I don't know. You are the only one in there. And I remember this girl being like, oh no, it's okay, you can. And I was like, well, I'm so appreciative that you're trying to work with me. And here's what I saw. I saw like you gagging a little bit, and you can't control that. Your body just does that. And usually that means, this doesn't feel good. I'm trying to protect myself. And I don't want your nervous system to be doing that. I don't think kids are realizing like, oh, I'm gagging, or I don't like this. It just is like, this doesn't feel good. And then when you're getting the message, like, it's okay, your clothes are fine, just put them on. It's so easy to be like, oh, my feelings are wrong, or this isn't how it's supposed to be. So kind of really being like, here are the specific things I saw, and I'm pointing it out to her. And also parents or caregivers, like, did you see that? That's a nervous system response that tells me this is not feeling good. My body's going into protection. Yeah. And we are not going to do that. I'm not going to push that, even though it's something that for a lot of kids, it is helpful. It's not the right fit for your nervous system.
Well, and we know, right? We know that autistic individuals process much more information than neurotypical brains, right? We know that the sensory information coming into the neurodivergent brain is so much more. Both of our guests talked about that, and we have some research about that. And so the idea that what myself as a therapist might think is acceptable and to put that on a child or another individual, I mean, what you're really teaching is you're teaching to the nervous system, you're teaching to safety. And I'm hearing you're bringing awareness, not only for the the child, but for the parent. Like,
Yeah.
be aware of your nervous system and how your own nervous system works within your own brain makeup or your own individuality, really.
Yeah.
Mm-hmm. I mean, really, our teachers are our kids that come through the door every day. I'm going to take it back to what occupational therapy is. So occupational therapy is supporting function. Like, that's what we're trained to learn how to do. Not only what I think function is, but what you think function is for yourself. That's the foundations. And so when we really think about what we're working on with our neurodivergent population, I think that this is a conversation we need to have, because there are many supports out there for kids with autism. There are many treatment models out there for kids with autism. How do we look at it as neuroaffirming occupational therapists?
Yeah, so I think it's a great question, and it's one that I think changes depending on the age of your child and where you are in life. And I mean, obviously, as you get older, the things you need to do change, and the things you care about doing are not the same for everyone. So I think kind of figuring out like, okay, I have a hard time wearing clothes, and what is going to be good enough for me. I have worked with kids where it's like, all right, we are wearing athletic style pants, and that's great. And I mean, sometimes I have to have a conversation with parents of like, oh, they still can't wear jeans. And well, do they care about wearing jeans? Do you care? Why is it important that they wear jeans? And maybe, realize it's not actually that important that they wear jeans. They are fine wearing athletic style pants, and maybe we can find one kind of stretchy waistband pair of dressy pants for when we have to do a choir concert or something, and we don't actually need to wear jeans. That might be different for someone who's like, I really want to wear jeans and they look amazing and that's how I want to express myself. Then yes, we will work on wearing
Well, then
jeans
it has function, right? Then it has function for the client.
Yeah, I think there's function of like, can I do what I want to do? And then is it meaningful to me too? Like some people are like, I don't care about jeans.
Or I don't care if I wear the same 6 shirts every day. Like, functionally, you can be fairly functional and wear the same red shirt every day, right? It's a mind shift around what is function. And so like, let's take that deeper, because we see a lot of families and kids who are getting really overwhelmed in our society. We're seeing kids who emotional dysregulation is a giant thing that we're working on, or the ability to go into different environments is a really challenging thing. When we look at that through a neuroaffirming occupational therapy lens, like, what are some of the considerations that you have, or the conversations you have with parents around, again, what does function mean for your family and for your child if they're, old enough to be able to have some words around it?
Yeah, so I think checking in periodically about like, is this helpful, and are we going the direction that you want to go, and that we are doing activities that are lining up with like, this is getting me closer towards this part of my life being easier. And then also like really looking at things that a child's nervous system and body is able to do, or what feels good, what doesn't feel good. Here's what I can handle. This is what's good for me. So there's awareness about that. But then there's also the task and environment itself. So, I had a kiddo once where they got really overwhelmed with going to the doctor, and it was just anxiety for days leading up to these appointments. And it came out that like, they said the doctors always lie. They tell me the blood pressure, it's not going to hurt. They're always saying this is not going to hurt. They were routinely checking blood pressure. When they do that, it hurts.
Yeah.
And this was just repeatedly just dismissed. And I mean, first, let's just validate that your body is experiencing getting your blood pressure done as pain. And that's really hard. And no one's believing you. So, okay, let's just affirm that that's true. And then we can do things to get your body ready for my blood pressure getting taken. And how do I get my nervous system in a good place? And then how do I recover? But also, how do we change the doctor's appointment? Is it medically necessary to have your blood pressure taken every time you go to an appointment? You can ask, don't do my blood pressure. I experience it as painful. Or having the ability to say, like, my nervous system perceives this differently, and giving parents the backup to be like, yeah, we're not going to do that. And we're going to advocate for this does not need to be a part of our doctor's appointment. So that's kind of changing the environment and the expectations of, we don't actually have to do this. Or like with brushing teeth, there's some research that suggests that if you are just brushing without toothpaste on your teeth, if you don't use toothpaste, that's still getting a lot of the plaque off your teeth, and that's better than not brushing them at all. And if some kids where we are like, okay, well, let's just do the toothbrush without the toothpaste, because managing all that foamy stuff and the taste, that's really overwhelming. Let's change the task so that it's manageable. Is it possible? And it's not like don't use toothpaste is the solution for everyone. For some people, that's still really overwhelming. And then it's like, how else do we modify the task? So we can kind of look at, how do we help your body have this be easier? And also, what can we change or adjust about this task? So how do we kind of question those conventions of like, do we have to do this? Is there a different way? And is that okay?
So I hear you saying, for those listening who are neurotypical, the idea of being really curious that your way might not be the only way towards function. And your toothpaste example was just so powerful, right? Like the function of, we really do need to clean our mouth is medically important. We know that. And are there other ways to support a nervous system or support a neurodivergent brain who, there might be other reasons that it feels challenging or tricky, but we can also look around the task and sort of adapt, and the curiosity, especially for parents, of sort of letting go of what we think is the only way to get to function, so that the child can like get through their day and have some nervous system reserves left, hopefully.
Yeah.
And so in our work as occupational therapists, I mean, we've alluded to that we're shifting the nervous system, right? That's the kind of the training we have and what our expertise is, but we're not just applying, you will do this and change.
Right. And there's something I also tell people is that like your nervous system is your nervous system. And I mean, there is neuroplasticity, and over time, like things can shift. And I am probably not going to take your very sensitive child and make them, nothing phases me. Like, you are probably always going to have, like, that sensitivity is a unique, wonderful part of who your child is. And I'm not going to make it so that, like, I love getting my blood pressure taken. I can't change that. I can try and make it easier, and we can problem solve together, because like I was saying, there's no one size fits all. Do this and it's great. But there are some things that are just like, this is a difference and it's okay. Like this is, in some ways it makes things harder, and it also helps you tune into things in other ways, or like, this is a really unique, remarkable way of experiencing the world. And it's a difference, and it doesn't have to be like this is a wrong thing. Like
a thing to be fixed.
Yeah, it's not a thing to be fixed. This is part of who you are, and that is wonderful.
So we're supporting function within who the child is, right? And supporting families to understand that, or to be on that.
Yeah. It's a process of going from like, wait, this is how I expected things to be. And like that shift of like, oh, does it have to be that way? Or maybe this was important to me and it's not important to my child. Like there's a process there of, it's not just like, okay, no toothpaste.
Right.
Like that is something that like, I mean, for myself, like, I'm like, I don't know. I like the minty fresh feeling of toothpaste in my mouth. And I also, like, my son is very overwhelmed with toothpaste, and it still is like, okay, I can cognitively know that this is easier for you. And still my body's a little bit like, really? Don't you want to use the toothpaste? But it's a process to let go of those expectations. And I think that's a journey. Like both places can be true. I'm sure you just experience that with any type of parenting, but it's something to validate of this is not just okay, just do this and it's good. It's a process.
It is a process. And, the final question I really wanted to ask, and you just started talking about it, is, for parents of newly diagnosed kids, that is such a tender time. What do you see as the greatest need of parents who bring their newly diagnosed kids to CTN? And then what do we do to strive to support that family system, family unit, and the child?
Yeah, I think there are so many things. Getting a diagnosis usually comes from a medical provider, and it's like, okay, here's your report with all these books to read and all these resources for you to go look up, and here's all these interventions and all this stuff. And it's a lot. And I think what families really need to hear is like, yeah, this is a lot, and it's gonna be okay. Like no one knows the future, and we will figure out what does your child really need to thrive. And I mean, maybe this is like a mindset change of like, you were just given this report with all of these, like, here's how to make your wonderfully square peg child look like a round peg. And, there's ways that we can work to put those square holes in society. It doesn't have to be, oh, this is all on you. Like there's a lot of ways to think about this, and it's going to be okay.
And I feel like just simplifying something that's not simple, right? To nervous system, connection. What brings meaning for your child? What brings meaning in your connection with your child?
Yes.
Right? Back to the foundations. And I hear in all of the clutter that, the reports and the treatments you're supposed to do, and you know what I mean? Simplifying. And I feel like that's something that we strive to do with families is just, let's just be where we are, right? Let's be with your child.
Yeah, your child is still the same wonderful child they were. And let's really figure out like, what is the core of this is what brings us joy. This is what we need to do in life. These things we can let go of, and this is what's important to us. So.
Yeah. And hopefully to walk with parents on the journey, as opposed to being, one more person saying you need to. I don't know that parents need any more you need tos yes. in the world, but, somebody just really support the family unit's nervous system so that they can find a foundation and some roots and some connection in that. All right. I think I'm going to leave it here. Thanks, Emily.
All right. Thank you.
Hello, Where They're Planted listeners. I wanted to pop on here and remind you of our Thriving Parents Collective online courses. If you like what you hear on this podcast and are seeking more, check out this resource. This course offers you over 9 educational videos and 50 pages of self-reflective workbook in order to guide you through the process of integrating connected parenting strategies into your day-to-day life. Listen when it's convenient for you and use the content as the foundation for a shared language between you and your partner or family members. In addition, access one-to-one sessions with a parent coach to support individualized strategies to help you meet your child right where they're planted. For listeners, access this course for $99 by using the code THRIVING at the checkout. We look forward to having you join our Thriving Parents Collective. Where They're Planted is a Lit Path Studios podcast and is produced by Jamie Gale and Jen Bluske. Music is by Gaston Reen and Pod 5. Thank you for loving your child right where they're planted.